All right. If you're looking for a girls' night out, how about one with a purpose?
Yeah, throughout the month of October, Rochester Regional Health is making it convenient to get a mammogram while pampering yourself in the process. Alexis live at Bay Creek talking about mammograms by Moonlight. Alexis?
Good morning, ladies. Yes, as many of you know, October is Breast Cancer Awareness Month. We're here at the Bay Creek branch of Rochester Regional Health. They've got the pink ribbons out, and they are doing something wonderful. Let's face it, we all get pretty busy scheduling different appointments and whatnot. But a mammogram, we all know how key and critical it is to a woman or a person's health care in terms of detecting breast cancer early. So they are offering something really neat, Mammograms by Moonlight. We're going to talk more about that. That's happening all for the month of October, where you can get manicures, you can get a massage, and there's so much more they have planned. We're going to talk to the experts about how they work, the whole process, and we're also going to talk about how you can get involved and the importance of detecting breast cancer early. So much information that we're going to get this morning and really help in that healthcare process. So we're going to have much more here on 13 WHAM and over on Fox Rochester.
Many misconceptions about mammograms, and that is why Rochester Regional Health has planned a girls' night out for the month of October. They're offering mammograms by Moonlight to help take the stress away about getting one. Alexis this morning is live from a location called Bay Creek with a look at how mammograms work. Good morning, Alexis.
Yeah. Good morning, Jen. Yeah, a great way to get pampered and, of course, take care of your health care, any personal health care needs. And this is a very important issue that women and men should, pay attention to. Amy Olson is a mammographer here, and we kind of want to give people a sense of what to expect if they were to come in. But there are different types of mammograms out there that I didn't realize, and maybe a lot of people at home didn't realize. How many different types are there?
Yes, that's right. There are two different types of mammograms. We do a conventional 2D mammogram, and we also boast the latest and greatest technology, the 3D tomo mammogram. So here at Rochester Regional, you could get either one of those. From a patient's perspective, they're very similar. When a patient comes in, we do the same amount of views, we do the same images, and unfortunately, we still need to use compression for both the 2D and the 3D.
Yeah, there's two different types. Is it a preference of someone saying I want one versus the other, or is it specific to a person's needs, or are there different factors that come into play?
Oh, there are different factors. Everybody is offered the 3D tomo. We really encourage women who have dense breasts, who have a family history or maybe a personal history of cancer, women who have a baseline or maybe have not had their mammogram in a few years, to go with a 3D mammo.
All right. What would you do to, there's so many misconceptions out there why people don't want to get mammograms. What would you say to people who maybe have a fear or are a little nervous, uneasy about getting one?
Absolutely. I tell my patients it's not going to be as bad as you think. It's a few moments of uncomfortableness. The compression actually lasts for about 4 seconds. It's released immediately, and it's not the worst thing that you're going to go through.
Okay, so we want to give people at home a little demonstration. We're going to do this on my hand, my fist. So not the typical scenario, but kind of shows you how the machine works. So what do you want me to do?
Okay, so let's take your hand. We're going to make a fist, and we're just going to set it here.
Should I?
So, yep, just relax.
Relax.
Your hand, and so this will simulate one of our views. The patient would just be relaxing at this point. The compression comes down with my foot pedal, and we put slight compression right there. We look at the compression, we check the tautness of the breast, how much we compress depends on the density of the breast, and obviously patient tolerance. This lasts for a few seconds, and then it is released automatically as soon as the exposure is taken.
And you tilt it, like you said, you take different vantage points.
Yes, both 2D and 3D mammos have a 2-view mammo, so 2 views on each breast, a total of 4 views.
Okay. Yes. We're going to talk to Dr. Kenneth Van Sickle here. We know that getting a mammogram is very key for early detection.
Yes. Yes, it's very important. Early detection studies have shown that women who have cancers that are detected early, and when I mean early, I mean they're small and they're still confined to the breast. If they're detected early, their 5-year survival is greater than 95%. But if it's detected late, at a late stage, say stage 4, which is metastatic or it's spread, survival 5 years can be as low as 20%.
Yeah.
So detecting early is very important. Women, as they get older, they're at a higher risk. Most invasive cancers are found in women older than 55, but 1 in 6 cancers are found in women from 40 to 49, and 1 in 8 women will develop breast cancer in their lifetime. So it's incredibly important. 250,000 women alone in 2016 will be diagnosed with breast cancer. So detecting the cancer early, it provides more treatment options, it provides better outcomes, longer-term survival, greater chance of survival.
Yeah. All right, Mammograms by Moonlight happening Monday from 6 to 9. They are booked to capacity, but again, not the only time that you can come during off hours. You can contact your Rochester Regional Health if you are a member here to find out more information about that. We'll put that all on foxrochester.com as well. When we come back, we're going to talk about, so you got your mammogram, what happens next?
All right, truth time. You and I have been talking a lot about mammograms. We know the importance of them. We know the value of them. We're hearing what happens during them. But kind of, we're like, all right, how do you take that first step?
Yeah,
We've
exactly.
been talking about it a lot. Truth. So combine that education with a girls' night out and one with a purpose.
Maybe it becomes fun and necessary at the same time. Throughout the month of October, Rochester Regional Health is making it convenient for women to get a mammogram while treating themselves in the process. Alexis Arnold is at Bay Creek today talking about mammograms by Moonlight.
We are at the Bay Creek branch of Rochester Regional Health. We're talking about raising awareness for Breast Cancer Awareness Month in October. Earlier, we kind of walked you through a scenario of getting a mammogram. So say you had your mammogram done. What happens next? We're speaking with Dr. Kenneth Van Sickle about those next steps. What are typical next steps for patients?
Well, if a patient has a mammogram and it turns out that there's something on that mammogram that requires further testing, which is a small percentage of women, it's 10% or less, but 10% of women will have a screening mammogram and then something will be seen that's not quite normal. And when that happens, they'll be notified by the office that the mammogram was done at, that they have they're in need of some additional testing. And so when they come in for additional testing, we typically do more mammogram views, but they're specialized views of the area that we were concerned about.
So more advanced testing, Amy, and are you a part of that in terms of what you're looking at? What are you looking for when when a patient has to come back?
When the patient has to come back, they have orders from the doctor, so they tell us the extra views that they would like to do.
Yeah, and it's something with the technology that you have nowadays. You said you've been doing this for a number of years, and you've seen a lot change in the scope of how these are done.
For sure, yes. It used to be film, and when we changed to digital, we really increased our visibility in the breast. And then when we changed to our tomo, or our 3D mammogram, again, we've really increased the amount of cancers that we can find up to almost 50%, and decreased the amount of times that patients do have to come back.
Yeah. We were talking earlier about some of the misconceptions about actually getting a mammogram. People think it's painful. What do you tell people to kind of ease their nerves?
Just to relax, and it only lasts for a few seconds. It's uncomfortable, but not painful.
Yeah, but it's very necessary.
Very necessary. We also have a 3D breast ultrasound that we do use in conjunction with the 2D and 3D mammogram. That helps the doctors with their fewer callbacks as well.
So we have Mammograms by Moonlight, which is an opportunity for women to pamper themselves and take care of their health care needs at the same time. But this isn't the only time you offer these kind of extended hours. Talk about the importance of why you guys do this, to offer these different times.
Well, we at Rochester General Health, we recognize that it's not easy for patients to be able to change their schedule, alter their work schedule to be able to get to a place to have a screening exam between 8 and 5. So having hours that are earlier than 8 o'clock, say before work, or after work up until 6 p.m., those are our normal late hours. And we also have Saturdays. We have up until noon, from 8 till noon. So that it enables women to be able to get there and get this very, very important exam that they might otherwise put off or not be able to do.
Knowing they have that option in such our busy lives can mean the difference between life or death, literally, because in early detection. Right?
Correct. That's absolutely correct. I mean, studies have clearly shown that women who get regular mammograms, their cancers are detected early, and early detection saves lives.
All right, so if anyone at home is watching and they want more information about some of these extended hours, how can they find out more?
They can go on our website. They can go on the Rochester General Health System website. They can call any of our offices and get that information.
And this is something you guys were going to do more of. The Mammograms by Moonlight. We're thinking extending this out throughout the year.
Absolutely. It's been a great success. Women have just loved it. It's more of an event, more something to look forward to. So we don't want to just do it in October, but we want to continue it throughout the year.
Yeah, and what better way to pamper yourself and, again, take care of those very personal health care needs. We're going to have all more information that you need over on foxrochester.com. We'll send things back to you in the studio.